Aspirin is a salicylate used to treat pain, fever, inflammation, migraines, and reducing the risk of major adverse cardiovascular events. In this video, let's find found. What is aspirin? What is aspirin used for? Contraindication. What are the side effects of taking aspirin? How does aspirin work? How to use aspirin? What is aspirin? Aspirin, also known as acetylsalicylic acid, is a nonsteroidal anti-inflammatory drug used to reduce pain, fever, and/or inflammation, and as an antithrombotic. Specific inflammatory conditions which aspirin is used to treat include Kawasaki disease, pericarditis, and acne fever. Aspirin is available without medical prescription as a proprietary or generic medication in most jurisdictions. It is one of the most widely used medications globally, with an estimated 40,000 tons, 44,000 tons, 50 to 120 billion pills, consumed each year and is on the World Health Organization's list of essential medicines. In 2020, it was the 36th most commonly prescribed medication in the United States, with more than 17 million prescriptions. What is aspirin used for? Pain, fever, and inflammation. Acetylsalicylic acid, ASA, in the regular tablet form, immediate release, is indicated to relieve pain, fever, and inflammation associated with many conditions, including the flu, the common cold, neck and back pain, dyspnea, headache, tooth pain, sprains, fractures, myositis, neuralgia, synovitis, arthritis, bursitis, burns, and various injuries. It is also used for symptomatic pain relief after surgical and dental procedures. Other indications. ASA is also indicated for various other purposes, due to its ability to inhibit platelet aggregation. These include reducing the risk of cardiovascular death in suspected cases of myocardial infarction, MI. Reducing the risk of a first non-fatal myocardial infarction in patients, and for reducing the risk of morbidity and mortality in cases of unstable angina and in those who have had a prior myocardial infarction. Contraindication. Aspirin is contraindicated in patients with known allergy to NSAIDs and in patients with asthma, rhinitis, and nasal polyps. It may cause anaphylaxis, laryngeal edema, severe urticaria, angioedema, or bronchospasm, asthma. Side effects. Abdominal or stomach pain, cramping, or burning. Black, tarry stools. Bloody or cloudy urine. Change in consciousness. Chest pain or discomfort. Confusion. Constipation. Convulsions, severe or continuing. Pharmacodynamic. Effects on pain and fever. Acetylsalicylic acid disrupts the production of prostaglandins throughout the body by targeting cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2. Prostaglandins are potent, irritating substances that have been shown to cause headaches and pain upon injection into humans. Prostaglandins increase the sensitivity of pain receptors and substances such as histamine and bradykinin. Through the disruption of the production and prevention of release of prostaglandins in inflammation, this drug may stop their action at pain receptors, preventing symptoms of pain. Acetylsalicylic acid is considered an antipyretic agent because of its ability to interfere with the production of brain prostaglandin E1. Prostaglandin E1 is known to be an extremely powerful fever-inducing agent. Effects on platelet aggregation. The inhibition of aggregation by ASA occurs because of its interference with thromboxane A2 in platelets, caused by COX-1 inhibition. Thromboxane A2 is an important lipid responsible for platelet aggregation, which can lead to clot formation and future risk of heart attack or stroke. A note on cancer prevention. ASA has been studied in recent years to determine its effect on the prevention of various malignancies. In general, acetylsalicylic acid is involved in the interference of various cancer signaling pathways, sometimes inducing or upregulating tumor suppressor genes. Results of various studies suggest that there are beneficial effects of long-term ASA use in the prevention of several types of cancer, including stomach, colorectal, pancreatic, and liver cancers. Mechanism of action. Acetylsalicylic acid, ASA, blocks prostaglandin synthesis. It is non-selective for COX-1 and COX-2 enzymes. Inhibition of COX-1 results in the inhibition of platelet aggregation for about 7 to 10 days, average platelet lifespan. Acetyl group of acetylsalicylic acid binds with the serine residue of the cyclooxygenase 1, COX-1, enzyme, leading to irreversible inhibition. This prevents the production of pain-causing prostaglandins. This process also stops the conversion of arachidonic acid to thromboxane A2, TXA2, which is a potent inducer of platelet aggregation. Platelet aggregation can result in clots and harmful venous and arterial thromboembolism, leading to conditions such as pulmonary embolism and stroke. It is important to note that there is 60% homology between the protein structures of COX-1 and COX-2. ASA binds to serine 516 residue on the active site of COX-2 in the same fashion as its binding to the serine 530 residue located on the active site of COX-1. The active site of COX-2 is, however, slightly larger than the active site of COX-1, so that arachidonic acid, which becomes prostaglandins, manages to bypass the aspirin molecule inactivating COX-2. ASA, therefore, exerts more action on the COX-1 receptor rather than on the COX-2 receptor. A higher dose of acetylsalicylic acid is required for COX-2 inhibition. Half-life. The half-life of ASA in the circulation ranges from 13 to 19 minutes. Blood concentrations drop rapidly after complete absorption. The half-life of the salicylate ranges between 3.5 and 4.5 hours. Dose. Pain and fever. Immediate release, 325 to 650 mg POQ4HR PRN or 975 mg POQ6HR PRN or 500 to 1000 mg POQ4-6HR for no 10 days, not to exceed 4g/day. Rectal, 300 to 600 mg PR Q4HR for no more than 10 days or as directed by healthcare provider. Acute coronary syndrome. For use as adjunctive antithrombotic effects for ACS, ST segment elevation, myocardial infarction, STEMI, unstable angina, UA/non-ST segment elevation, myocardial infarction, STEMI. Acute symptoms. 160 to 325 mg PO, chew non-enteric coated tablet upon presentation, within minutes of symptoms. If unable to take PO, may give 300 to 600 mg suppository PR maintenance, secondary prevention. 81 to 325 mg PO QD indefinitely, preferred dose, may give 81 to 325 mg/day. Regimen may depend on co-administered drugs or comorbidities. Extended release capsule, Durleza, RX, 162.5 mg, PO QD. Primary ASCVD prevention with low-dose aspirin. Adults aged 40 to 70 years, consider use of low-dose aspirin, 75 to 100 mg PO QD for select adults who are at higher risk for atherosclerotic cardiovascular disease, ASCVD, but not at increased bleeding risk, AHA/ACC 2019 Guidelines on Primary Prevention of Cardiovascular Disease. Adults aged greater than 70 years, low-dose aspirin should not be administered on a routine basis for primary prevention of ASCVD. Ischemic stroke and transient ischemic attack. Initial, 160 to 325 mg PO within 48 hours of stroke/TIA onset, followed by 75 to 100 mg PO QD. ASA recommends an initial dose of 325 mg within 24 to 48 hours after stroke. Do not administer aspirin within 24 hours after administration of alteplase. Maintenance, secondary prevention. Extended release capsule, Durleza, RX, 162.5 mg PO QD. Anti-inflammatory. Use of non-aspirin NSAIDs has largely supplanted the use of aspirin for osteoarthritis, rheumatoid arthritis, and other inflammatory arthritides. Immediate release, usual maintenance dose, 2.1 to 7.3 g/day. Divided doses, Individualized dose, monitor serum salicylate concentrations. Colorectal cancer, off-label. Prophylaxis. 600 mg per day PO. Decreases risk of developing hereditary colorectal cancer, i.e., Lynch syndrome, by 6% if taken daily for at least 2 years. Safety advice. Aspirin is listed as a U.S. Food and Drug Administration, FDA, Category C drug during the first and second trimester and a Category D drug in the third trimester of pregnancy. That's all the information about aspirin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.